Hi, I'm Dr. Kelly Starrett, physical therapist and human performance advisor for H-Wave OTC. You've selected an H-Wave OTC because you've had shoulder surgery or about to have shoulder surgery, and we want to show you how to get the most out of your unit. Now, one of the things we can do here is talk about how to set up the pads. It's a lot simpler than you think. So if Sean was having some pain in the middle of the joint, one of the things we could do is take a single lead. Here's the single lead, and I'm just going to place that on the front of the shoulder and the back of the shoulder. And theoretically, what's going to happen is he's putting energy through that system, and that's going to help him feel some relief in this spot. Typically, if we're in really acute pain management needs, we could say, hey, let's go ahead and keep this on for an hour and let's go off for an hour. Because we're talking about pain in this situation, we can also add a second input. So now what's happening is we've created 2 points of access, and the energy is going to be concentrated on a specific spot. Don't be afraid to say, hey, I'm having some achiness in the middle of the joint, but also say, I've got some achiness in the front of the joint. So now you could actually move that around and have a couple areas that are being addressed. The key is to think, hey, I'm going to put energy through the joint and I'm going to move those pads around to my liking. And that really is where people start to feel very comfortable with this technology. So instead of having to come home and take the Vicodin again, we might be able to manage that post-surgery pain or post-rehab pain with sort of a non-drug intervention using the high-frequency setting. The idea here is to give you on-demand pain relief so that you can then create an opportunity where you can sleep, or create an opportunity where you can feel like you want to move, or you can get a real needed, much needed break from sort of the incessant ache that is common post-surgery.